The country is well on its way to vaccinating those who fall into Phase 1A, including frontline workers who treat people with COVID-19 every day. One of those people is Dr. Matthew McCambridge. He's the Chief Quality and Patient Safety Officer for the Lehigh Valley Health Network. Dr. McCambridge, thanks for being here. You also work in the ICU, right?
That's right. I'm a pulmonary and critical care physician, so I work on one of our intensive care units.
So you got your first dose of the vaccine, what, 10 days ago? Any side effects? How are you feeling?
Yeah, I got my first shot on December 18th. There was no side effects at all. The nurse who gave it to me gave it through a very, very small needle, and the volume is about it's about 0.3 cc. So I didn't even feel it. Didn't even feel it go in.
And now more than a week since that first dose, absolutely no residual impact.
No side effects at all. I was looking for them, but I didn't experience any kind of side effects at all.
All right, so let's not borrow trouble, right, as they say. And as someone who's waiting for their second dose, and obviously as a medical professional, what do you have to say to people who might be waiting for their turn to take the vaccine?
Sure, it was really simple. It was safe and effective, and my second shot is on January 6th, and it was really not a big deal at all. It went very smoothly. I had to wait about 15 minutes afterwards because there's been a very small percentage of people across the country have had reactions afterwards. But after about 15 minutes, they let me go, and it was nothing to be afraid of.
Is it a huge relief to begin that process to get vaccinated, and all of your coworkers now feeling like they're beginning the road to getting protection from this virus because you're around it, obviously, in the ICU?
No doubt, it's a way to first see that light at the end of the tunnel, and it's a nice way to not only protect ourselves but to protect our patients and to protect our families and everybody in the community. It's a way to. We went into this all those years ago. We all went into this to help people and save lives, and this is just another way of saving lives.
And speaking of the ICU, what are you seeing there? What's the situation? Is it full? Do you see a spike in cases?
We saw a spike in cases that started about 4 weeks ago. Our ICUs are full, but we're able to manage the volume. We've had to open up some additional ICU beds and some regular low-level and medical surgical beds, but all day long, there is a handful of us that are talking throughout the day to help ship the beds internally in the big hospital and also receive patients from the outlying hospitals as well. So it's a little bit of a puzzle each day, but we have beds and we're doing well.
Well, Dr. Matthew McCambridge, we're so thankful that there are people like you out there helping to treat these cases, and we thank you for sharing with us how you're doing as you've begun this process.
Well, thank you very much for having me.